See, we have the respiratory system which is going to power the system, laryngeal vocal folds. Vocal folds are going to adduct. Okay. Now in this one you have a system called hard glottal attack, breathy attack, and what is the other one? Huh? Three types of attacks are there. Simultaneous. The whole physiology is like this. When you have the air which is coming from below, passes before the vocal folds are starting to vibrate, then it results in a breathy attack. You say like ha, ha. That means before ah, there is a bit of ha air which is escaping. That is breathy attack. Simultaneous is, it is just when the air is moving, the vocal folds are adducting and abducting, vibrating. Ah, that comes. If you have a hard glottal attack, that means the vocal folds are pressing too hard and then the air is pressurizing it. So in order to relax it, the muscle is very tight, what you will do? That's what is chant talk. When you
demonstrate that
hard glottal attack?
Yes.
Ah. I am exaggerating it. It is like ah. Ah. See, it is like you reduce your cough. Earlier we did that a brief example, no? Before coughing, you just hold. Ah. That is hard glottal attack because the vocal folds are in a tightened position. The air is, the other thing is when you actually do it and open, right? Sometimes you keep on doing it and suddenly it comes boom. That boom is hard glottal attack. Yes, right. Thank you.
Thank you, sir. I should tell. Any change in voice? Very minute. Don't give pain or anything. Just gently.
Again, if you permit.
Yes, sir, please.
First of all, try to identify that. You have to palpate and find out where there is a V type of a notch. In gents, it is very prominent. Ladies, it will be merging with the cricoid cartilage.
You can swallow.
Okay, so what you do is you keep your finger and just swallow. When you swallow, the whole of larynx will move up and down. There will be two notches. That's where the anatomy comes into picture. The signet ring which sir was mentioning, that will be below, and then above that there will be a prominence. Okay, so that prominence you should not just hold and pull it down. It has to be gently, you have to apply a pressure, digital manipulation. There is a small groove. Why should you do that? Again, that is important. Digital manipulation, you are going to do this, but why you have to do that? Yes. Why you should do that? Lowering pitch is the effect. Mechanism, what will happen? Vocal folds? Shortening or lengthening? See, vocal folds, if they become like this, it will be shortened. But you are pulling it down like this, it will be lengthening. Okay, so what is this digital manipulation is to establish low pitch. Now, all those people who can appreciate their laryngeal prominence, keep your finger on the larynx and then try to produce the voice which I told in the morning, no? Low pitch. See where is the movement. Whether the larynx goes down or up. When you produce a low tone, it has to go down. Now again, don't answer me. Don't answer me. You look out for yourself. That's why I said you keep your finger on your throat, establish that prominence, and now you produce a high pitch. Whether the prominence is moving up or low.
Up.
Now, in case of a puberphonic, what happens is the larynx is high. Therefore, You have to help him to understand that you have to lower the larynx in order to produce a tone that will enable him to come with a normal patterns.
Yes.
Asne?
Yeah.
Yeah, okay.
So all of you do once.
Yes.
See, you do, you will learn. Do.
Keep your finger. Otherwise, I will
Yeah.
demonstrate that. Now you produce a. He is resisting. See, there will be some
Yeah.
amount of resistance.
Then you have to.
Resistance is always there. In the nature, there is resistance. You ask somebody to do this, they will say, why? Why not? So when you do with this one, even the muscles, they will be resisting your movement. So you have to gently help him to lower it. The reverse of it is when you do the relaxation function. So that's why I was telling you need not even touch the patient. What you do is you do reverse phonation. Reverse phonation, inhalation phonation. Morning you all did. Ah. So what will happen to that?
Any change or same?
Do you feel relaxed or not? No relaxation. So you are not tensed only. If you are tensed, then there will be relaxation. Okay. The pure phonic will have a tense this one. So therefore you have to go for larynge. Oh, you have changed the technique, huh?
Digital manipulation.
Okay, digital manipulation. So that is it. Inhalation phonation. There comes inhalation phonation. We are. You speak, Baba.
You tell, sir. It's okay, no problem. Sir, tell inhalation. No, you tell. It's okay, you tell.
No,
sir.
no, no.
Inhalation also you tell.
Your topic. Not mine. I am not seeing this.
I'll come later, inhalation.
Okay.
Now we'll go for laryngeal massage. What is laryngeal massage? Yeah. How will you do? Why you will do? No. Relax the muscle. Some inside pain they are telling, we can give them little. Do. How will you do?
Now the
First,
question
keep
is
your-
which muscles you are going to identify.
That's it. Which muscles does need exercise?
No, this is common. Laryngeal muscles.
తిట్టుకుంటారు నన్ను నేర్చుకుంటే పర్వాలేదు బట్ అదర్వైజ్ ఇట్ షుడ్ నాట్ బి దట్ సార్ ఇస్ ఆల్వేస్ ఓవర్ పవరింగ్ అంటే కాదు ఎన్ఐహెచ్ ఎనఫ్ నో ఐ డోంట్ వాంట్ దిస్
No, no, tell sir.
No, it is something like when you have the various intrinsic and extrinsic muscles. Okay, so you identify some of the things like when you turn this way, you have this muscle. Okay, sternocleidomastoids. The names are those which will identify where it is originating and where it is inserting. Similarly, you have when you. That's why I recommend that you all should go to a operation theater and look at the muscles. See here in the laryngeal framework, you have these muscles which are extrinsic and intrinsic. Can you touch the intrinsic muscles? Not much. Only extrinsic you can do. The digastrics, okay, which are laryngeal elevators, the depressors. So what is the purpose of manipulating or doing a laryngeal massage? Relaxation. So for which kind of problems you are going to advocate this therapy technique? Strain, or where there is a lot of tension. How will you identify whether there is tension or not? Simply you will advocate this or you will identify the tension. How? There you will have to feel, or sometimes you can feel that one. The neck, if you see, stiffness will be there. Sometimes the laryngeal muscles are so strengthened or tensed up, they will appear on themselves. So that you can see, feel that in terms of it. How can we demonstrate? See, look at this muscle. Okay, when you turn that other side, you have the tension here. Okay, when you should know how to evaluate for the muscle tone. So that tone will help you to understand whether it is tensed or relaxed. Similarly, this one. Okay, then you have the digastrics which are going from here to this place. Okay, so you have to feel the tension underneath the chin. Okay, so these things. Maybe for that requires a chair.
Yeah.
You have make him sit and then demonstrate. Give a demonstration. Turn this side.
Yes.
Okay, so what you are going to do is you are going to see this both the muscle groups. Okay, this is one muscle group, the other way this one, and then you have to stretch out the muscles here. Below the you have the jaw, isn't it? All of you can do that. So you put your thumb on both sides of your inside the jaw and then push it slightly inward. You will find a tense band of muscles. They should be relaxed. Okay, so there you are going to give some, it is like when you do early morning exercise, no? Stretching. So why does the stretching help you? Relax. So you do a little bit of forward bending, backward bending, and similarly you are going to do these things. And you have what is called as the muscles which are masseter muscle is there. All those muscles which are, sir, muscles details I think you can give some idea.
Muscles, the suprahyad muscles that
Yes.
helps to elevate the laryngeal system.
Right.
So it will be digastric muscles, all stylohyoid muscles will be under the chin.
Yes.
So as sir said, you have to press them and see for the tension,
Right.
and accordingly give him some relaxation therapy in the form of
Right.
massage, hot fomentation.
Right. If you are not able to identify that properly, you will add up with additional pain for the client. Okay, so that has to be done. So for that you have to look at the anatomy portion of the laryngeal muscles. Only then you will be able to do that.
Any physiological technique to assist the tension?
Tone of the muscle. See,
Stiffness will be with.
Not subjective, but any physiological test objective.
No, sir, it is external, no?
stuttering.
Stuttering also it is.
There also you can
Yeah.
use that. Full body you can focus from toe to the head and then do the whole this one. Yeah. Okay.
So, sir showed you some techniques like this sternocleidomastoid and all. There are other massages also. Like
Yes.
you can just keep your hands like this. All of you can try very gently. You are not pressing, squeezing, nothing. Very gently, like a V shape, you come down. Do for 5-6 times. You feel some change or anything you are feeling. You try.
Now first let them tense their muscle. That will give them the relaxation.
No, even this you will feel some kind of heat. This will be
Is that
there.
so?
Yeah.
I have not tried.
In these cases, chewing will also help.
All these are relaxation.
Any change? V shape. When you have little, like very minute pain and all, this will work out.
Is chewing a good habit? Does that do anything good for your
Too much is
throat
no.
or? I've heard some people say.
No, actually, if you should realize is are we dealing with bones? Are we dealing with cartilages?
Yes.
Are we dealing with muscles?
Yes.
Are we dealing with nerves?
Yes.
Okay. Now, among them, what is responsible for movement?
Muscles.
What can happen to a muscle? Either it is contracted or
stretched.
relaxed. If your muscle is too stiff, what will you do? Relax it. If it is too relaxed, strengthen it. Those are the exercises. But it is your job to identify whether it is stiff or relaxed, and if so, under what circumstances. That is the crux. It's not just, we have boiled down to the minimum core. That muscle can only be stiff or relaxed, too relaxed, flaccid, or in the tone. If it is in tone, that would result in a normal voice. Okay, so if it is stiff, you end up with an abnormal voice. If it is too flaccid, abnormal voice. So if it is stiff, you go for relaxation. If it is too flaccid, you go for strengthening. So that will be the exercises. Thank you.
Next one is which one? Pushing. I think sir told very deep.
Or he is pushing a heavy object. What is happening there?
There is a pressure on the abdomen muscles.
One,
Main is somewhere else.
What function of physiology of larynx only.
Yeah.
Learned in
The
the
thing is
body.
closed.
Yeah.
Epiglottis is complete. The vocal
Cord
cord
is close. So there will be a pressure below the.
Subglottic.
Yeah.
No, in which conditions you are going to advocate this technique?
When there is vocal cord. Which
Ah.
problem?
Dysphonia, all anything abnormal is
Yeah.
dysphonia.
See, think yourself. Which condition movement will be affected?
See, in that one, a form of hyperfunction mechanism used for puberphonia and psychogenic voice disorders. So, what is going to happen there? Suppose I don't have a chair. So, what can I do?
As if assume you
We can't assume. We have to do.
Clench your
Yeah.
fingers like this. And do it.
You can start pulling it by yourself. You can start when you pull this. What will happen?
same effect is coming.
Yeah.
You are going to adduct the vocal folds. Where there is hypofunction, you are going to do this.
What is hyperfunction?
Isn't it?
Yeah.
Okay. Right. मैं इधर ही खड़े हो जाऊं क्या?
Yeah, sir. No problem. Actually, like, sir is, I told no, my teacher also. So how sir learned, how we learned is totally different.
No, that is okay. It is sharing. Now
Yeah.
let us not go into that.
So this is clear. All of you try. Make a pressure below your vocal cord and try to say ah.
Which disorders you will use this technique for?
See, mostly it is we will use for this vocal cord paralysis.
Why? What happens there?
See, the movement will be affected or not. Okay, one will not be moving, whether it is unilateral or bilateral. So what you are doing, giving more pressure, you are trying it to move.
Compensate. Compensate for the lack of movement.
Movement.
Right.
Next, yarn sign. I think that everyone will do now.
Yawn sign.
Long inspiration with maximum widening of the supraglottal.
Yeah, that is a
Yawning. See, what is yawning? Next time you won't call me. That's why I am standing every time. What is yawning? Huh? What is yawning?
correct.
That forget. What is yawning? When do you yawn? Lack of oxygen. It is a natural body response to open up. So when the system is opening up, it relaxes. And sighing. What is sighing?
Again relax.
Ah.
Exhalation. Relaxing. On exhalation.
Okay, so inhalatory relaxation, exhalatory relaxation. That is yawn sigh.
So all of you do once.
Already.
That is that already.
Yawning is going on since 2 o'clock.
Hmm?
No, it is very contagious.
Yes. You say ha.
That is what. Add one word.
Ha. Ha. Now say ah. Ah. Now you
With
say
yawn.
ha. Ah. Ha. Everybody sleep. That is what you say, hypnotherapy. You say 10 times you are going to sleep and then do this, you are into that mode. Okay.
Next. Chewing also. This one?
There is a doubt. He explained when yawning is a respiratory thing, how the fetus yawn with oxidation.
Yeah.
What is the theory of myoelastic aerodynamic theory of potential?
That is done over. Already over.
Over no, in this process. Yawning process.
Sir.
What is that?
Sir,
Question.
if yawning is a, like we have relaxed oxidation process, the fetus yawns in embryological science. features respond to sound also.
Okay.
So the auditory stages are started by the sixth or seventh, third pharyngeal abdomen. So what is the thing with yawning? This yawn of the yawning is happening. It is a reflex or autonomic nervous system or other nervous system involved.
Well, the nervous system part I don't know, but as far as the respiratory system goes into it, the birth cry is the first initiation of respiration, to my knowledge. But when you are seeing that baby is yawning, it may be the swallowing mechanism also, because the baby swallows. Yes, that is what meconium is taken inside, so that will be cleared when the baby does not cry. So that is what I would think it is a more of a swallowing reflex.
Yawning is a reflex basically. For inhalation, exhalation after the birth only it will happen.
Right.
On the day. So yawning have a relaxation technique. Usually these yoga expressions and everything, they also practice breathing exercise.
Yes.
So what is the differentiate between your breathing exercise and their
See,
yawning and breathing?
all these exercises are given by somebody's experiments, right? But they have a foundation in terms of the physiology. Whether it is you call them as pranayama or some breathing exercise, the idea is to fill the tank of lungs. Lungs are the tank. Morning I think we had discussed that this is the air supply tank. So the tank will have to provide fuel for the vocal folds to sustain a voice. Unless you have air in the lungs, you cannot sustain a voice. Okay. So in what way you are going to relax the system so that the maximum efficiency could be produced as output.
So Vandenberg theories,
Hmm.
bioelastic aerodynamic theory of phonation.
Basically Vandenberg's muscular, that is what is important is myoelastic and aerodynamic theory of phonation is, it explains that to some extent the air pressure which is going out of the lungs is encountering the elasticity of the vocal folds. Okay, the vocal folds, they are into a state of tension. Okay, so with this tension there is what is called as a prephonatory phase of vibration, and then the air is going to pass through the vocal folds. Okay, when it is passing through that one, the stretched vocal folds will engage into a phonatory phase.
So how we use in gastrostomy and tracheostomy level?
Which one?
This voice because it is not coming up. No?
Tracheostomy you don't have voice unless the vocal folds are involved. You have what is called as a laryngectomy, in that you use esophageal speech.
Gastrostomy we done.
Gastrectomy, what they do is they remove the stomach portion.
No, the muscular area. So you are talking
Yes.
about the aerodynamic muscular area, persistent or not.
Yes.
Because
So,
when psychogenic will come, you are talking about phonia, they have a tension of neurogenic effect. Because thought never conflict with the breathing.
no. Basically, the aerodynamic myoelastic theory model works on the basis of the elasticity of muscles. There is also one more theory called as neurochronaxic theory. So that where it happens is the nerves are going to determine the number of times the vocal folds are going to vibrate. Okay. So that being the scenario, when you have gastrotomy done, that means what, the vocal folds are removed, the extent of the
What is gastrotomy? Laryngectomy is done.
laryngectomy is done. After that you remove the stomach.
Gastric pull-up.
Pull up, yeah. So in that what happens is the amount of air that is going to inhaled into the stomach, and that is going to produce the sound. For that matter, I will demonstrate to you the esophageal voice.
When we do auscultation and analysis,
No. In this particular voice, is this voice or not? It is voice, but is it produced from vocal folds?
No.
It is burping. After a heavy meal or having ingesting soda, you are going to produce a sound.
It's coming directly from here.
I am belching. It is belching.
assess them and we train them before to do this stuff, to swallow their own air.
But yeah, it is a failure one type of muscular regeneration happening in dystrophies.
Right.
Very typically dystrophies, it is cannot be. Again, it will be degeneration happen.
Dystrophy.
See, I look at it in this way. See, in all these conditions, wherever the muscles are too tight, you will have to go for relaxing. And wherever they are loose, you have to strengthen them. So once you do that, what happens is the aerodynamic muscle theory which you are talking is like a balloon. Can I have a strip of paper? Yeah, I have it. Just hold on this one. No? Sound is coming? On what basis? Is it vocal fold?
No,
Then how the
sir,
sound
then
is?
mechanism of resonance.
Which one?
Mechanism of resonance is a question mark, no?
No, it is not the question. It is the air which is vibrating, no? That
No,
is
the
causing the
resonance
resonance.
column has to be vibrated. It is in psychophysics we will say the
Agreed.
voice can. For
Agreed,
example,
agreed.
in
See.
sleep also you talk.
Right.
Brain doesn't recognize.
Yes.
When you
Yes.
sleep,
Yes.
when you snore you don't recognize.
Right. No, we
So
don't
that
recognize.
Time, we don't recognize. There is no conscious mind or subconscious mind there. But in that time snoring affects or not, like where the basic question will come, acidosis affect it. Like you all blood
Now,
filling,
how
everything
that is
there.
related to voice disorder?
Acidosis directly, acidosis loses the voice.
GERD.
Yes, GERD is one of these, acidosis.
Okay.
MCS, multiple chemical sensitivity.
Okay.
For example, if ulceration,
Right.
and my pH level increases more than the level of my neutral level.
Okay.
So acidosis increases totally the area, acidic level. Even though a simple cola with the aspirin you inspire, it will totally damage that area. So how, which therapeutic techniques like this will useful for restore this for a SLP?
Actually, what is happening is we need to understand that the whole issue of rehabilitation should be removal of pathology, restoration of anatomy, and relearn the physiology. This is the basic principles. So when you have this kind of a acidosis, it comes in the purview of the medical doctor to do the necessary methods of reducing that. Once that is done, we have to see what is the pathology that is happening to the structures. If it can be corrected through rest, or does it require any voice therapy. Then subsequently you have to go for whether the muscles are involved in which way, and then how that can be retrained. ठीक है?
Oh, sir, 1 minute.
After this, after the
This is
presentation.
not. The students has to know that how it is a matter of that. It is organicity or function, sir. You may know that. That's
Which one it is organic? No, as you said, it is organic.
It's a functional level. How the intervention they are brought about.
See, organic always you have to make in terms of being in a team approach. Always the team works for the management of a particular client. It should not be that something we are just establishing. That's where the assessment part takes a very important role. See, what you have to do in this particular condition is you are looking at whether there is anything that is life threatening or is it functional. What is the difference between functional and organic? What is functional, what is organic? What is functional and organic? See, I will tell you one thing. You all seen a cycle? You are riding a cycle. The air in the cycle tire is reduced. What will happen? Difficult to do that. Suppose the same tire has got a puncture. Now, which is organic, which is functional? Puncture is organic.
The problem in
The structure.
structure.
So, can you fill air and then run it for some time? Maybe for some few meters. But always it requires to be added with a patch. So therefore it requires some intervention that will correct the anatomy. So that is organic nature. Functional is because of this usage, the air has come down. You refill it, again it can function. You do some retraining, it can function. Does it clear the doubt raised by sir?
Sir, the point is, their assessment is, as a SLP,
Ah.
their assessment is organic level evaluation or function level evaluation.
Both.
Both.
Which test and everything they use.
That you should have come early, no? That is over.
No. You are saying intervention.
Yeah.
You doesn't paid about assessment-based intervention.
It-
Protocol is wrong of ICD and
No ICD is the
No, we
DSM-5
had,
we
it has
don't
been
follow.
discussed probably in the earlier things that we have subjective analysis, objective analysis.
intervention, there
Hmm.
is a ICF protocol function. It's a disorder, no? It's not a disease.
Yes.
It's a disorder. So ICF protocol, which area of assessment have which area of intervention? Evaluation-based intervention. Screening.
See, you are bringing the psychological domain into it.
No. It is possible. It is written in your function book only.
Yes, okay. It is not there. See, if you are raising a doubt from the book, I think you forward that book to everybody, we will also go through that. If it is from your experience, we will discuss.
Ma'am.
Experience is failure, sir. So many times physicians never refer it. Here also I am saying.
No,
Physician never refer it. Physicians assessment never come to SLP.
see, what is happening is, we are still at a phase wherein we are going to build that synergy. We are going to build the synergy. If that is discussed in this divergent ways, we will lead nowhere. Okay, it will be only we will be prolonging the discussion, otherwise there won't be any constructive method. So, right? Yes, Jish.
Yeah. Thank you. I should stop. No, these are just other techniques. Resonant voice therapy, you can read at home. SOVT, again you can, this straw will be there. Later you can try at home. I'll share you the slides. Okay.
See,
And
these are all issues. You can just go back. We can just add a little word to that one. Semi-occluded vocal tract exercise, it says. What do you understand by that? Semi-occluded. Half occlusion. Can you think of any example in our day-to-day life where we use that principle? You are gardening your garden with water. If you are not able to reach to the other side, what will you do? Half occlusion. Yes? So when you are not able to project the voice by the singers, what you do is half occluded
You can go.
vocal tract exercises.
Go, no problem.
Okay, so that is how it actually functions. So when you have a particular system in terms of using the resonance that is not being able to focus to a larger extent, then you squeeze your structures so that it will be projected further. Okay?
See, there are many ways in that. So one we can use very commonly is,
Underline one, increase mean airflow rate. What example I had given you? So if you press the tube, it will go further. So that you are increasing the mean airflow rate. Okay. Which one? No, they are also, she is also demonstration for this. See, I told you, no, see in voice what happens is, for all the things, our structure should be pathological. See, esophageal voice I can demonstrate, hoarse voice I can demonstrate, high pitched voice I can demonstrate, but half swallow this one, it depends on the pathological structures. So there you will be able to do that.
you can take a straw, take a glass of water and try to blow it. Make sure one bubble comes.
One bubble, huh?
One bubble. Yeah.
Okay.
So that is exercise for that. Or you can take it and say, with this ooh you start telling, you can sing a song also, no problem. Okay, So see how
the idea is how we are going to increase the mean air flow rate. The flow rate, see, as I told you, when you are phonating, it is about 150 to 175 cc of air. So that you are going to reduce by occluding. Occluding means what? Closing.
Yeah.
So by closing the structures, becoming more narrower, you are going to increase the pressure.
And the advantage of this is you can do with almost all the patient with voice problem. Another thing is muscle also will get increased. Normally muscle is very difficult to increase in voice. So even post-surgery patients who come with vocal nodule, vocal polyp or any kind of voice problem, you can give this so that their muscle tone also will increase and the recurrence of the problem will be less. Understood? So if you are in ENT hospitals, you will come to see many patients post-surgery coming for rehabilitation. So these all will be helpful for you. Now last, head positioning. I think everyone knows head positioning, yes or no? So there is a small change in what the normal head positioning we do. So what is head tilt? Can anyone show? Head tilt. I think everyone taught us head positioning, but that head tilt one word is missing. No. So now when you do, yeah, there is a small tilt of your head. Then you should go for sidewise, up, down, rotation, all this head positioning, but with a tilt. Tilt means what? See, before how you used to do or now all try with tilt, with a gentle tilt front, like giraffe. It will be easy to understand.
Now what does it actually accomplish?
Actually this was the technique, sir, but the tilt word was removed slowly.
Okay.
So everyone started doing there is no use.
This is not tilting.
No. You have to do the positioning with the tilt. So you do this and say it will improve the.
No, but that is for unilateral vocal fold paralysis.
Yeah, not only that one, sir. It is common. Mostly we can use in vocal fold palsy patients, but others also. Head positioning wherever we use, it will be useful.
Okay.
Old head positioning is there, no? Up and down. We used to do, no, sir. Before. Now they came up with head tilt. The same procedure, but there should be a tilt.
Just check for any videos are available and then you can think of. That would be better. It gives a better idea of how to do it.
Slowly.
Feel the tension that generates. I can feel it pretty easily. So sometimes if you have some, and feel how that space kind of compresses down. If you take two fingers, you're going to take your middle finger and put it right below the base of your skull. And you are going to then slide your chin forward and feel how that space kind of compresses down on your fingers. Now, as you repeat that, see if you can sense what's happening in the front of your neck. See if you feel the tension that generates. I can feel it pretty easily. So sometimes if you have someone come into your studio who says, oh, the front of my neck is just feeling really tight, have them put two fingers right into this space, this sort of soft space right below the base of your skull, and think about, without really changing the position of your cervical spine, can you slide the head forward and back a little bit? and see if they can find a place where you don't feel the compression in the back and the tension in the front lessens as well. So that's sort of one way to deal with that. If there's no squeeze in the back, no tension in the front, you've probably got a pretty good head position for them. Now, the other type of forward head position that might be, I think, a little bit more common is addresses the flexion in the neck. So extension is akin to back bending, and flexion is sort of like forward bending. But sometimes if you've got a curve, a lordotic curve that's going inward in the body, the way it is in the cervical spine, if you lose that lordotic curve, you have flexion of the neck going on. So it's a loss, in this case, the flexion of the neck is a loss of that natural curve that we should have. And we see this as the ears sitting pretty far in front of the shoulders. And there's a great image from an Eric Dalton publication that talks about how every inch forward.
Clear, no? Understood, no? Head tilt. You are just gently. See, false vocal cords, when it will start involving, when there is, like sir demonstrated before, when Faninder sir was there, when you need to increase your pitch. So the what is false vocal cords? The neighboring area. So first thing we can do is all this relaxation techniques are there, no? This will helps to minimize. Okay, then again this SVOT, all this can help you in reducing the function of false vocal cords. That by when people speak only you will come to know.
See, it is like false vocal folds are floating. Okay, when you want, it is something like this. When you actually involve the true vocal folds, okay, false vocal folds need not work. Have you ever seen in terms of our buses, RTC buses in olden days, when you travel, no, the window panes will shake. Usually they should not shake, but they start shaking. Why? If you get the answer for that, this is the mechanism. See, when the vocal folds are being overburdened, they are not able to cope up with the thing, the false vocal folds will come into picture. They are like the borders of the curtain. Okay, what is supposed to vibrate is the true vocal fold. If that does not take care of the necessary things, even the false ones will start moving. What to do for reducing that? You have to reduce the pressure. See, if the vocal fold, true vocal folds, it is something like this. Suppose at home I am the earning member, my expenses are more, so I have to tax my wife also. Okay, if I have to reduce that, what I should do? Improve my efficiency or reduce the overall expenditure. Same thing. So you relax the system so that the participation of the false vocal folds will reduce, improve the efficiency of the true vocal folds. Okay, right.
And singers will use false vocal folds as a chord songs are there, because that will be add-on for you. When you go very high pitch, then by default you will sing in false vocal chords.